every politician should be committed to making sure that New Yorkers are protected and that New York's security is well funded. But while our politicians are waging war and supporting the war with a theory of security, that we will achieve security by sending our children overseas to kill other people's children, I would argue that this is not going to bring security to our state. In our state, many New Yorkers are without health care. The New Yorkers without health care need the security to be able to go to the doctor. All New Yorkers need the security of universal health care to avert public health crises, to protect New York from public health threats. Many New Yorkers live in fear of being evicted or losing their homes. As New York's Lieutenant Governor, I will fight hard to bring affordable housing to New York and fair legislation, fair laws to protect tenants and small homeowners. Education is reportedly the top priority for voters in this election, and well, it should be, because it is the first step to economic security for New Yorkers. As New York's Lieutenant Governor, I will fight for free and effective public education all the way through our great public university system. And finally, the last issue that is vital to all New Yorkers is economic security. And for too long, New York has been without economic security. As New York's Lieutenant Governor, I will work with our Senate candidate, Howie Hawkins, to bring economic initiatives to New York to put our vast, talented, underutilized workforce back to work in a sustainable energy economy. The biggest issue in hospitals and the logic behind building a hospital, maintaining a hospital, is the population that it serves. Not the profit that it makes for a corporation, but the population whose health is bettered by the existence of a hospital. Florence Nightingale, who was one of the first pioneers in healthcare, who used statistics to determine where a hospital should be built. Prior to that, hospitals were built in areas that were considered fashionable to have a hospital. And fashion and the whim of society determined where healthcare was available. Healthcare needs to be available to every New Yorker. And as Lieutenant Governor of New York, I will push for universal healthcare and for a healthcare program that adequately meets the needs of our population, and especially our low-income population and working populations.